Hello, welcome. This is a Keystone Contractor Association webinar. This is part of our 2023 employer education program. And this year we focused on drug use and drug testing within the construction industry. And we are just thrilled and honored to be able to feature the National Safety Council as part of this series. And joining us today is Clair Bryant from the National Safety Council, and her presentation is titled Impairment at Work, It's Complicated. So without further ado, take it away, Clair.
Awesome. Hey there, everybody. Nice to meet you. As John said, I'm Clair Bryant with NSC. I will get into some background on who NSC is if you're not familiar with us. And would love to, we have a small group today, so would love to engage with you all throughout the presentation. So if you have questions or thoughts or comments at all, feel free to go off mute or put things into the chat and we can keep it casual to go through some of this content. But of course, the topic of today is impairment. And so even just the word impairment loves to cause confusion on what does that even mean? How does this impact the workplace? So we're going to get into that, and then I will pay special attention to a new resource that we have that is available for free for Pennsylvania employers. So would love to engage with you all on that and hope that's something that's of interest to you today. So for the agenda, I'll talk about who NSC is and our mission, the scope of impairment at work, how to address impairment from multiple causes, since this is a very broad issue. And like I mentioned, the focus on that free training for supervisors. And then we can finish with a brief overview of NSC resources. We have a lot of free content on our website that you might not be familiar with, so I'm happy to go through the resources that we have in case you have any questions about those. So while we can do Q&A throughout the presentation, there will still be some time at the end for dialogue as questions or comments pop up. So National Safety Council has been around for over 100 years. We're a 501c3 nonprofit. We've been around since even before OSHA, and workplace safety is our bread and butter. We were founded as a result of the Triangle Shirtwaist Factory fire in New York City. And that was a pretty tragic incident that instigated folks to really start paying attention to workplace safety. And that was our call to action at that time. And we've certainly evolved over the 100 years that we've been around. And our mission to date is to eliminate preventable deaths from the workplace to any place through leadership, research, education, and advocacy. And so while we focus on the workplace, we also focus on roadway safety as well. And of course, those two topic areas are interrelated. So that's really how we strategize around our work. So let's go ahead and dig into the topic at hand. When I say impairment, what am I referring to? And you might have some ideas. I'd be curious to hear what pops into your mind when I say that word. I think just to get us thinking, I know it's nearing the lunch hour and folks might be getting a little sleepy. So how do you feel when you might have had a bad week of sleep? How does that impact, your performance or your behavior? Maybe doing yard work in 90-degree weather. I live in Chicago, so anytime it's 90 degrees, that certainly is something that really fatigues a lot of the folks who live here. It normally doesn't get that hot. Repeating the same task over and over again. Drinking alcohol or using other substances. Being stressed about the well-being of a loved one. Certainly that can impact how we are able to focus on the current task at hand if we're doing something else. And then even using certain medications for allergies or colds, over-the-counter medications in general, and even certain prescription medications. All of these things can impact our performance and how we're able to react and respond to situations. So I think this is just some good food for thought as we think about the things that can possibly relate to impairment at work. And so for NSC, the way we talk about impairment specifically is a person's temporary inability to do their work safely. And I like to emphasize temporarily. We're not talking about disabilities in this conversation. Things like substance use, things like extreme temperatures, things like stress and mental health related issues. All of these things are not necessarily going to always cause impairment, but they can certainly cause it, especially in combination with other things or in extreme cases in general. So thinking about the broader scope of how all these different topic areas can impact workplace safety is where we're trying to encourage employers to think about this topic area. And usually this falls outside of typical abilities. So comparing people to their own baseline is an important consideration on how somebody might be performing today versus how they were performing yesterday versus comparing them to other workers. And as I alluded to, it's caused by many factors. We're not just talking about substance use. Most people think about substance use when we are thinking about impairment. I think we've done some good work on the impaired driving side of things. We're thinking about drowsy driving, for example, and distracted driving. But we're not always thinking about that on the workplace side. So just some food for thought, again, as we think about all the different factors that go into how you perform at work. And to actually address impairment, I think this is pretty obvious, but it's important to note, it's impossible to address impairment fully without getting to underlying factors and their root cause. So sometimes that might just be as simple as sending an employee to rest for a quick break. Other times that might be as complicated as getting treatment for an untreated substance use disorder or untreated sleep condition, for example. So the way that we actually can prevent these issues really ranges depending on the cause. And there's a lot of different causal factors to consider. But ultimately, that is our goal, is to make sure that we are getting to the root cause so that it's not a reoccurring issue within the workplace. And so while NSC has our definition that we refer to, it's important to also acknowledge that there's no standard definition when we're talking about impairment, both on the research side, the policy side, and in the workplace. A lot of folks use different definitions, and there's nothing that is standardized. I think it's important to call out that Canada actually has a workplace impairment standard. It's a really helpful link that's in this slide if you're interested in checking out what that actually looks like. They have some implementation guides as well. So there's other countries that are thinking about impairment more broadly and are a little bit more progressive on the topic than perhaps the US is. And so they have some good resources and good references on how to think about the topic of impairment. But certainly there's no workplace impairment standard that is similar to this in the US, although we're starting to talk about it and think about it in this way. Some other terms that are related to this topic area, if you've heard of the concept of total worker health, fitness for duty, readiness to work, and then in general, performance, cognitive, and physical effects and productivity are all terms that we have seen in looking at the research that relate to this concept of impairment, but it's really not a black and white topic area. And as we talked about, it's frequently associated with substance use, but it's much broader than just that alone. So to give you some more context on all of the different factors that could go into play with impairment, I do want to highlight before I go through some of these examples, just because somebody might be experiencing fatigue or low blood sugar, for example, or anything that's on this slide, it does not necessarily mean they are impaired, but these are associated with impairment. And it's also important to note that it's not only personal or worker issues that can cause impairment, it's also factors that can be contributed from the workplace directly to employees. So the way that we like to think about all the different factors that can contribute to impairment is we break them down into these three buckets. We have chemical factors, physical factors, and psychosocial factors. And so chemical factors, things like legal drug use, alcohol use, substance misuse, all of that really falls into this first bucket, but also things like chemical exposures fit into this category as well. For physical factors, most of what we focus on at NSC is fatigue, and I'll get into some statistics in a little bit about why that is. But also certain health conditions can impact the way workers perform, and sleep deprivation, for example, is another example here. Related to exposures from the workplace, extreme temperatures. I gave that example of working outside on a hot day. I know with a lot of the construction over the summer, that's a big hot topic on how can we make sure workers are getting enough rest, water, breaks from the sun, because that can impact our ability to perform safely. And then other issues such as time on task, like I alluded to earlier as well, on repeating the same thing over and over again, and also just working at something for a long time without a break. And then lastly, psychosocial factors. This is really anything related to mental health that can cause mental distress and especially impact a worker's ability to focus on the job. And in the workplace, this even includes things like psychological safety, harassment, and violence. So there's a lot of different things going on here, and they're fluid in nature. We put them in these three buckets, but they certainly overlap and act with one another. And so there's also another way you can think about impairment is in terms of acute impairment and chronic impairment. So acute impairment is really what I call real-time impairment, which is a person's inability to do their job safely in this moment. versus chronic impairment, which is essentially reoccurring instances of acute impairment. When we talk about this, it's really in relation to ongoing conditions that are left untreated, such as diabetes, unmanaged mental health disorders, sleep disorders, chronic exposures to anything in the workplace that may cause impairment that can lead to more longer-term issues and frequent instances of that acute impairment. And obviously, both of these situations, whether it's just something temporary or something that's happening quite frequently, can lead to workplace injuries, incidents, and fatalities. And in general, with all these different factors, they can lead to physical and cognitive changes, which in turn can lead to the impairment. So really things that can impact the body and the brain in general. So such as changes in our heart rate, our dexterity and mobility, our coordination, for example, and can also impact our brain in relation to our response time or our memory, even experiencing things like brain fog. So these are general signs and symptoms of some of the effects that can happen from these different causal factors that were on the previous slide. So that was an overview of how to think about the issue of impairment, but what do we actually know about the risk of impairment, especially how does this relate to workplace safety and the outcomes that we're seeing on job sites? It's actually a very complicated question, as you might imagine. Impairment is not usually measured as the underlying cause of incidents, injuries, and fatalities. Especially because of the overlap of all these different causal factors, it's hard to isolate them when we're measuring for exposures in the workplace. Usually we're looking at the direct cause of injuries when we are doing our fatality reviews or we're doing any kind of internal incident reporting. We're looking at the direct cause, but not always asking deep questions about what else might have been going on with that worker that could have contributed to the event. So we don't have good information to provide a holistic overview of the impact of impairment the way we might have for other topic areas on workplace safety. And so there's not a lot of clear measurement for understanding impairment. We might be able to do drug testing, for example, but that helps us understand if somebody has used a substance, not necessarily that they are impaired by that substance. And those are two very different things. And for other topic areas related to other things such as fatigue or stress, it's hard for us to even measure the prevalence of that within an individual. And when we're looking at the overlap of all these different factors, it's hard to understand, how much of all these things does it take for somebody to be impaired? When did they cross that line of when they're safe and then when they're no longer safe? I like to think about impairment as a spectrum. We're not just simply impaired or not impaired. We exist on this spectrum. And I think it's safe to assume that most folks have some level of impairment. We're not usually operating at 100%, right? So where do we cross that line in which we can create an unsafe situation? And that's the million-dollar question on this topic. But I will say we do have a good chunk of information that goes to show that it is an issue prevalent in workplaces and it is causing negative safety outcomes, even if we don't have the complete picture that we would want to have to understand the issue as completely as possible. So some of the things that we like to point to when we're talking about the impact of impairment on the workplace is that it can, of course, impact safety, but it can also impact employee well-being and cost. For those of you who are a little more familiar with the National Safety Council, you might have used our calculators, our cost calculators, and I have a link to those at the end. But it's a really helpful tool if you're looking to get buy-in on taking more action to address substance use or fatigue or mental health. To be able to show your costs on an annual basis, to go in and put the statistics for where you're located, what type of industry you're in, and how many employees you have, and it will calculate your costs on an annual basis, and you can use that as a tool to advocate for more support and policies and interventions to prevent these issues from taking place, because it will have a cost savings effect. But let's get into more of the specifics on what these statistics say. We did do a survey a little while back just to reach out to employers generally to understand how employers think about this topic area and if they're seeing the impacts of impairment on safety. And it's a perception survey, so it's important to note that these are just how the respondents felt about these different questions. They did not look at any specific data in their own workplaces. But we did find in this survey that a little over half of the respondents have stated impairment is decreasing the safety of their workforce. And 45% say impairment is causing more near misses, and 39% say impairment is causing more injuries. And so while we might not have concrete data to back that up from what they saw in their workplaces, it's something that most of us are seeing happen in real time. And you might have similar, stories to share on this as well. So breaking this data down by topic area, thinking about chemical factors, we know that 67% of people with a substance use disorder are in the workforce. Not to say that if you have a substance use disorder, you're not impaired. That's not true. But they might be more at like higher risk for impairment, especially if their substance use disorder is severe and they might be using substances at work. That's certainly a risk to consider. We also know that there was nearly 110,000 overdoses reported for 2021 in the US at large. And of course, if there's issues happening outside of the workplace, they trickle into the workplace as well. And I think something that's not often talked about is that overdoses account for almost 10% of workplace fatalities are due to overdose on the job. So certainly that's a direct effect of substance use, even more than impairment. That's a direct relationship to fatality. And so we do have data to understand overdose on the job. Quest Diagnostics has found that workforce drug testing positivity has climbed to the highest level in 2 decades. Those numbers just continue to increase. We're seeing a lot of prevalence of drug use, which can impact impairment. And we did a survey, as we love to do at NSC, and found that 1/3 of employees that they've observed cannabis use during work hours. Thinking about our physical factors, 13% of work injuries could actually be attributed to sleep problems. I think more and more employers that we've interfaced with have paid attention to this and started to consider how they can implement fatigue risk management systems, especially if you are using any kind of shift work or irregular hours for your workers. This is a really important topic area to start paying attention to if you're not already. We also found that 97% of employees have at least one risk factor for fatigue. Again, that's probably not surprising. Most of us feel like we're probably operating on E sometimes, and that's a big problem when we think about how that can impact especially safety sensitive industries such as construction. Extreme temperatures is one of the other topics that fits underneath this bucket. And so that there's been more and more data in the research that's shown that this negatively impacts especially things like reaction time and sensory perception. And then lastly, with psychosocial factors, of course, there's been a lot more attention paid to mental health and related topics since the pandemic. We know that more than 1 in 10 American workers has had at least one episode of serious psychological distress in the previous 12 months. And so it's important to think about how the prevalence of this can impact the workplace, because there is data to show that moderate and severe mental distress have been found to increase risk for workplace safety incidents. And something that we often see is the comorbidity or relationship between mental health conditions and other conditions that are also associated with impairment, such as fatigue and substance use. Okay, so I don't want to give you too much information and data. I know that can get a little dry after a bit. So let's actually transition into what do we do about this? There's a lot of different things going on underneath this topic umbrella. There's a lot of different factors. There's a lot of ambiguity surrounding this. So what do we actually do to take action? So there's a lot of things on this chart. I think the most important thing to note is that it's important to address impairment by taking baby steps. You certainly don't need to have all of these things in place. You might already have a lot of these different interventions in place. But this is just to give you some perspective on all the different things that you can consider, either integrating into your policies and programs or thinking about and talking about within your individual workplaces. And so when you're creating policies and programs to address impairment, I think it's important to have elements of these different areas to make sure that you're addressing topic areas holistically. So making sure that you have policies related to prevention, such as providing trainings and making sure that you have good insurance coverage and time off options, to early intervention, more about some of the screenings that you might want to have coverage for, looking for ways and mechanisms to report potential impairment, especially in ways that are non-punitive. Looking at incident response, making sure that you have systems in place for that emergency preparedness component of this topic area. Reoccurrence prevention, looking for ways to address more of that root cause, like we talked about earlier, such as providing accommodations, even policy or workflow changes, depending on the situation. And then looking at this from an ongoing maintenance, structure that you would need to have in place so that you are considering all the different well-being related issue areas that can come into play in this topic area. So there's a lot of things, like I said, on this chart, but I'd like to drill down a little bit more deeply into trainings and technology. NSC is focused on these two interventions because we see them as, resources that can address impairment holistically. While it's important to have resources on fatigue, for example, or mental health, we wanted to see what interventions might exist that can talk about all these different topic areas to make this more manageable to think about and address. And so we embarked upon a research project in 2020 to overall investigate the availability and efficacy of trainings and technology related to impairment. So the trainings that we looked at were specific to supervisors, since that's commonly a group that is targeted for workplace trainings, especially because we see them as on the front lines when it relates to identifying and addressing impairment, and then also impairment detection technologies. And I'll talk a little bit about what that means as well. So within this research project, we found that these interventions are certainly available, but they did not have strong evaluation to support some of the behavior change that might have occurred because of these different interventions, or the validity of using them in the workplace related to the technology piece. A lot of the training specifically that we found did not address impairment holistically, so they were very focused on substance use, which is typically how we've addressed this issue, and certainly a salient one that we should continue to address specifically, but did not really consider the impact of other things that can influence our performance. When we reached out to employers, we heard that folks were looking for other options that did not currently exist on the market. And in general, there was a very punitive focus on some of the trainings that we were looking at, with not integration into that total worker health frame, which is something that NSC really values, and we were looking to see in some of the trainings that were available. So this work has informed training that we have at NSC that we released in October of 2021. It's our impairment recognition and response training for supervisors. And so it's an hour-long e-learning, and the ultimate goal of this training is to improve the ability of workplace supervisors to both recognize and respond to diverse forms of workplace impairment. So going back to all the different causes we've been talking about today, making sure that that's all part of the picture and how we're thinking about and addressing impairment at work. We did do a pilot evaluation. As I alluded to earlier, there's not a lot of research on these trainings to see how they're performing in real life. So we did complete a pilot evaluation, and we just actually submitted that data to the Journal of Occupational Environmental Medicine. And we're continuing to evaluate the training just to make sure that it's doing what we hope for it to do. The overall learning objectives of the training is really the importance of recognizing and responding to impairment, supervisor responsibilities. So what is their role as it relates to recognizing and responding to impairment? And I will say, while this is directed at supervisors, other workplace professionals can benefit from this information, especially safety professionals and HR professionals. The common causes of impairment are also covered, common signs and symptoms of impairment. And the bulk of the training is focused on the 6 steps to respond to perceived impairment, just to break it down as much as possible, so that hopefully later on, when using this information, it's easier to follow a process that fits within whatever your policies look like. And of course, other considerations to have in mind, including when to involve HR, prevention, and then laws and regulations. So why supervisors? I mentioned before that they're really considered to be the first line of defense. I'm sure you have a lot of training for your supervisors because they are the interface between the employees and upper level management to make sure that the day-to-day things are running smoothly, employees have the support they need, and the job sites are safe. So the same thing applies for when we're talking about impairment. We really see them as the best audience to train, because we've seen also in the research that they can positively alter safety attitudes and knowledge as well. So a lot of this I won't spend too long on, since it replicates what's in the learning objectives, but we have different modules in that 1 hour that go over these pieces that are listed on the slide, with, of course, the signs and symptoms of impairment being a priority, and then responding to impairment, referring back to that 6 steps. So I'd like to spend some time here just going over some of the signs and symptoms that we review in the training. We break them down into physical, cognitive, and performance indicators. If you've taken other reasonable suspicion trainings or reasonable cause trainings, a lot of the signs and symptoms are broken down into the different substance, for example. And so we really felt, and from experts that we've worked with on the training, that it was not important to get into the granularities of the signs and symptoms of fatigue impairment versus the signs and symptoms of impairment that might be experienced during extreme temperatures. That's a lot for supervisors to have to manage and understand. And there's a lot of commonalities between the signs and symptoms from all of these different issue areas. So that's why we broke them down into these 3 different areas so that they're a little bit more manageable. And at the end of the day, it also comes down to supervisors understanding their staff, their team that they're working with and interacting with workers on the job site, to know when they're acting differently. It goes back to that baseline. If somebody's acting outside of their norm, that's when there's more cause for concern. Some people might look impaired to somebody who doesn't know them, but if you know how they perform, that's the best indicator for when something might be going amiss, and definitely cause for a conversation. So this relates to what I was just sharing on needing to keep this feasible. Supervisors do not need to be drug recognition experts. That's not what they're paid to do. They're paid to supervise and do the work. And it's important to have that relationship so that they can understand something's going wrong. And it's also important to understand that you don't need to know the cause of impairment to respond appropriately. So we don't need to jump to conclusions around why somebody might be demonstrating some differences in their behavior. It's more about taking action and having that conversation to just check in with employees. Sometimes you might not need to do a formal intervention of any kind. It might just be checking in to make sure somebody's okay and having that conversation. And that really goes a long way. So getting into the 6 steps that I mentioned before on what these steps look like, there's a lot more information in the training itself, but just so you can have a preview of what this, how this information is shared, we have the first step is safety. Of course, as National Safety Council, that's going to be the first step for most of the things that we put out, making sure that the situation is safe, whatever has happened, if there was an incident of any kind, that you're taking care of potential concerns. And then the second step is gathering information, whether that's talking with the employee, whatever is going on. This could also be something that's short-term or something that you've been noticing for quite some time and you decide it's worth reaching out to them to understand why you're noticing certain things. So gathering that information with the employee or others who might have witnessed a certain situation, making sure to keep it to factual information and not just gut reactions to what might be going on. And then, of course, needing to document that information. It's not to be for punitive purposes, but making sure that, especially if this is something that's going on for over a period of time, that you have information to refer back to that is factual, that you can use in follow-up conversations as you need to. The 4th step is preparation. And this is really all about looking over what you've documented, looking over certain company policies to see what those next steps might need to be. Especially if there is an incident. There's a lot of policies that might say that you need to do a drug test within 5 hours, for example. So making sure that you know that information so you can start the process and involve folks who might need to be involved in that conversation, especially with companies that have resources for an HR team. That's certainly when HR is usually brought into the conversation and updated before you get to step 5. And step 5 is the action step. So usually it's having the conversation with the employee about what's going on, what might need to happen. If you have policies that are indicating different steps that need to be followed, making sure that you are all talking about that together so the expectations are clear. But really just allowing for space for the employee to share their perspective on what happened, again, instead of jumping to conclusions. And within that step, depending on what the situation is, you can decide on the specific steps that you will be taking based on your policy, which could include potential treatment for things that have an underlying issue related. And then step 6 is very important. It's following up with the employees. Maybe an employee received a certain kind of accommodation. Maybe it was a false alarm and the employee wasn't feeling good and they just needed to rest, but still following back up with them to make sure whatever change happened, whatever's going on, they are feeling comfortable and they are able to work safely and not just leaving it alone after the action step has taken place. So just to provide some context on what those action steps might look like, this really ranges depending on your organization, the policies you have, and obviously the industries that are using this kind of training. But sometimes it could just be as simple as sending an employee home. obviously never driving themselves if you're worried about potential impairment. Having the employee complete a drug or impairment test, depending on your policy, referring them to your employee assistance program or other kind of treatment program if that's something that maybe you have an occupational health provider that you work with that can help to refer employees to other kinds of support. Following your organization's progressive discipline policies, especially if this is a reoccurring issue that does not seem to be improving despite support from the employer. And then identifying reasonable accommodation for employees. And there's, a million different iterations of how these could roll out depending on your organization and what's going on with the employee. And so I won't read through all of this, but I just wanted to note that we got some really good feedback on our initial pilot evaluation. And we were happy to see that after 3 months, 44% of our participants immediately applied what was learned. So they had an opportunity to actually use this content and the steps on the job site. And a positive benefit was also folks talking with their management and others at their organization about company policies to see what they need to have in place in order to make sure that you're prepared for when potential impairment comes up. And so that brings me to something I really wanted to make sure that we had time to discuss today, is that we are offering this training for free for anybody, any employers that are located in the state of Pennsylvania. And so you have this website, nsc.org/PA, that you can go to sign up for the training for free. And it's a really simple process. You put that information into your web browser and it will take you to a form that you fill out, just some really quick information. And then you will receive an email with an access code for the training. So you will need to set up an NSCL account to actually take the training since it's an e-learning. But you can share this link out with your staff or others that you know of who might be interested in this training. And then you can access the training for free. It's mentioned on the slides. This is available for a limited time only because we have funding from the state of Pennsylvania to actually help us offer this for free. And so our grant goes until the end of December 2025. But if we see a lot of quick uptake, we might not have funds to cover it throughout the entirety of that time. So I definitely encourage you to have conversations with whoever you need to, or go ahead and just take advantage and get a code for the training. So that way you can make sure to be able to access it while it's available. I'm happy to answer any specific questions about this if you are interested in learning a little bit more. And also, if you would like to share this opportunity with your networks in the state of Pennsylvania, we have a flyer that summarizes a little bit about what the training is and how to actually sign up. So I'm happy to give that to you if that's easier for you to use it as a communication tool. So feel free to email me about any questions you have in general, and also if you would like a copy of this as a PDF. Unfortunately, it's not on our website right now. It's something we're hopefully going to be able to put up there. But in the meantime, I just wanted to make sure you know that you had this in case you wanted to share this opportunity broadly with some of your contacts. Switching gears here, I'm not going to spend too long on this, so we have time at the end of the presentation for questions. But like I mentioned in the original research that we did that informed the supervisor impairment training that we just discussed, we did also look at impairment detection technologies because this is also an intervention that we consider to be a broad tool in addressing all the different topic areas that fall underneath impairment. And so we did a research report to better define and understand what's available and how these tools are evaluated. And the overall purpose of the report was to examine the current state of impairment detection technologies for workplace safety, as well as the scientific evidence around the use and value of those technologies. So we have the report that's available for free on our website. And then there's also a web tool that accompanies it if you just want to see the kind of products that we identified and what they assess, how long they take to use, and things of that nature. And so I'm not going to, like I said, go through too much of what we found in the report, but just so you know, when I'm talking about impairment detection technologies, the way that we defined that within the research is a technology with the potential to screen for multiple forms of impairment in order to aid in fitness for work assessment. I say potential because a lot of the data that we collected is based on what the technology vendors shared with us. And there's certainly a lot more evaluation needed to prove that all of these different products can be used in the workplace, at least to the level of degree that we would like to see for technologies that are utilized for workplace safety. But we found a significant chunk of technologies that are really working to help workplaces better identify and address impairment. And it's something that we're seeing a lot more research on this topic area. So it's an overall landscape of what products exist and how they're being utilized. And it is important to note that when we're talking about these kind of products, they don't usually identify the cause of potential impairment. Some of them consider themselves to be cause agnostic. So while they are looking at biomarkers or indicators that are associated with different causes, they are not saying this person is impaired because of X. They're saying that there is a certain level of impairment that might be cause for concern and warrant next steps by the employer. And they're certainly not intended to be a punitive tool. They're something they've become more popular as an alternative to drug testing if that's not something that you're required to do, because they can understand ideally potential impairment instead of just presence of a causal factor. Of course, the potential benefits of these technologies is that they occur in real time. A lot of these tests are done even before a shift starts. They offer a little bit more privacy. I know there's a lot of issues, and especially related to employees not appreciating the privacy concerns related to drug testing. They can feel invasive. They offer comprehensive detection, so looking at things outside of just substance use. Potentially cost savings, the more that you're doing to prevent these issues and get to the root cause, in which these technologies can help to understand what might be going on with your workers to get ahead of things before they're costly on the back end, and which also relates to the opportunity for prevention. But as you think about technology in general, there's certainly many barriers with adopting these kinds of resources. And the first that we found in some of our research and getting some feedback from employers is the purchase cost, and employee distrust or fear of the technology is something that is a barrier to actually implementing these potential solutions. So overall in the report, we found 15 different technologies that met our inclusion criteria. We had 5 of the vendors claim that they could detect for all impairment types, because we asked them a series of different causes of impairment, and asked which vendors, what their product was more closely related to in terms of how it could identify potential impairment. And so we had 5 of them that claimed that they could detect for all kinds of impairment or general impairment. Ocular motor based testing and psychomotor vigilance testing are the most common. So picture goggles that you can wear over your eyes, or camera based technologies that track eye movement, and also PVT, which is usually a touch based test. So think of perhaps a smartphone app that employees are using that are gamified to measure your reaction times and your vigilance, or what those are referring to if you're not familiar with this topic area. 10 companies reported evaluation for more than one type of impairment, which we're excited to see. And most of these applications are mobile or handheld, so they're pretty easy to implement in a workplace setting in that respect, instead of it being a large thing that they would have to put in the workplace that's hard to move around. So that was just a brief overview of that report, since that's related to some of our initial research. But if you have any questions on that or would like to see the report, I would definitely encourage you to check it out. So recapping here with this chart again, as I mentioned, there's a lot of different ways that we can take action, and we don't have time today to go into all of the different layers to what you could be doing and considering to address impairment. But just know that there are many options for you to consider, and some things might be more feasible than others. And certainly would encourage you to take the training, since it's available for free, or offer it to your staff as a way to get more engaged in thinking about this issue more broadly than you might be already. And perhaps you already are, but if not, it's a nice opportunity for providing training to workers if you are able to do that. And so, like I mentioned, we have a bunch of free resources on the NSC website that are related to all these different topic areas. We have a lot of information on cannabis. We actually have a new web tool if you're looking to understand a little bit more about some of the regulations and labeling requirements, for example, in your state in Pennsylvania. We have our Opioids at Work Employer Toolkit. This we created a few years ago, and we're actually updating this to be in a roadmap. For those of you that were on early in the call, I was talking about a roadmap that we're creating that we will be launching in February. So that's going to have a lot of great information on how to address substance use and mental health specifically, that we will be transitioning this content into that resource. But for now, we do have a lot of good information in the toolkit that helps to provide information on what you could consider adding into your policies, basic educational information on opioids and substance use, and things of that nature. And then here's the icon of the calculator. that I'd also mentioned at the beginning. And that's a great tool, especially if you, substance use is obviously a big concern in the construction industry. And so if that's something that you're looking to get some more buy-in on, I definitely encourage you to check out that tool, so you can plug in your information and get some projected costs that you can use as a communication tool. We have some resources on fatigue, similar to our Opioids at Work Employer Toolkit. We also have fatigue toolkit. And essentially this toolkit helps you to create a fatigue risk management system in your workplace. If that's one of the topic areas where you're seeing a lot of workers dealing with fatigue issues, there's a lot of information that breaks it down into bite-sized pieces. So if you want to take baby steps to consider what policies and programs might need to be expanded, you can find a lot of information in there to help you have those conversations. And we also have our fatigue cost calculator, and then some of our survey reports that we've done just to get information on the scope of fatigue at work and how workplaces are experiencing this issue and how they perceive this issue. We have some free reports online that have that information. And then lastly, for our psychosocial factors, we have our mental health cost calculator, and we have our SAFER, which is the Safe Actions for Employee Returns. It's a program funded by the CDC. That came out of the pandemic to help employers address the pandemic concerns. And now that we are mostly post-pandemic, we have a lot of resources that are specific to mental health, since that's a topic that was certainly of interest because of the pandemic and the effects of the pandemic. And here is just some a reiteration of some of the resources we have on impairment that can address multiple causes. And in general, just encourage you all to dig deeper when we're thinking about why injuries and incidents and behavior changes in general might be happening on the job site. It's important to dig deeper and just ask those questions to see what employees might be dealing with, or kind of thinking about this a little bit more broadly. And I think that'll help us get a long way into better providing support for employees and also decreasing injuries on our job sites. So with that, I know that was a lot of information. I would love to hear if anybody has any questions, comments. We have a little bit of time left to do that. So thank you all for your time.
Awesome. And yeah, there was a ton of information. We have probably very few registrants actually tuned in. You know, I think they're waiting for the registration, the recording link, like I said here. But the people that we have, they're the brains of the operation here. These are some top-notch professionals on the Zoom here. So I'm sure we'll get some questions, but I'll start it off here. I just want to say that I went through the training, the impairment for supervisor training, probably about a year ago, and I would highly encourage others to do so as well. I found it very informative, very helpful. The videos were helpful, and the information, and they even give you documents that you can use within your policy and helps you create your policy. So, you know, hats off to NSC for creating that. I thought it was first class and very beneficial for employers. So I just wanted to add that. But when it comes to impairment, I think that you know, we all can agree that it can you know, add the cost and add the safety issues, you know, with impairment on the job site. But as far as getting others to talk about it from peer to peer, having employees talk about it, do you have any examples beyond the training? I mean, the training's probably a great resource to encourage that, but do you have any other advice or examples or anything to share as far as being okay to talk about impairment amongst your employees? You don't want to be,
Yeah.
you know, it's a tough position to be in, but.
Yeah, I think that's a really important question. And so we don't have any specific resources that get to that. But in general, it's about socializing all of these different topic areas in your safety talks and your toolbox talks that you're doing, making sure that there's support from above to be talking about these different topic areas and sharing stories when people are willing to do that. Certainly, it's not always the case where people want to talk about it, but the more that you can socialize it from up top and when you're doing some of your more formal safety programming, I think it allows for comfort from employees to be able to talk with each other and look out for each other. We've heard a lot from folks that we've interviewed for different research projects that one of the best underutilized resources to address impairment is to encourage employees to look out for each other. They're the ones who are with each other day in and day out. And having non-punitive policies that allow for people to feel like they can come forward is the easiest way for employees to also feel like they can report potential impairment if they're concerned about one of their coworkers. So I think it's a hard thing to be able to do that and to create that culture, especially if there's different regulations that prohibit you from being as lenient as you might want to be sometimes. But I think just socializing these topics in general, especially related to substance use, because it's something that all of us really have exposure to, especially in maybe our personal lives that does come into the workplace setting. So just talking about some of those experiences to destigmatize the issues, I think is a really important first step.
Thanks.
Claire, I had a quick
Yeah.
question. It's Darren Reck. Thank you. A lot of great stuff you went over. We continue to look at the marijuana issue. We've had our attorney run as far as our drug and alcohol policy. Do we include it? Don't we include it? And, I guess stay tuned for all that as you mentioned. But my question to you is, I'm not sure if you covered this, but we have, as far as impairment for supervisor training, our supervisors have reasonable suspicion training, and I know it's a little bit of a different lens to look at it, from impairment for supervisors to maybe reasonable suspicion. I mean, we look at reasonable suspicion just in case we need to remove somebody and we're trying to justify it, right?
Mm-hmm.
It's more of like a compliance thing than a personal, we see there's an impairment sort of issue that, hey, do you need help? So it's completely different. Do you see it that way? And does the impairment for supervisor training, hold any weight as far as removal from a job site?
Yeah, that's a really important question. And I didn't do a good job to clarify this in covering the training, is that the impairment recognition and response training for supervisors that we created is essentially a reasonable suspicion training. But it does take, the reason we created the way we did with more of the compassion oriented approach is because of the reasonable suspicion trainings that exist are really punitive in nature, which is understandable when you are trying to deal with making sure that your job site is safe. You want to make sure that you're have procedures to address potential concerns. But I think this is a more progressive way to do that, and keeps in mind that every workplace does have different policies and how they handle cases of reasonable suspicion. Sometimes you may have to terminate employees, but the training that we have keeps it so that you can determine that based on your own policies. So this is our a reasonable suspicion training you can use for the same purposes.
Okay, great. Yeah, that's awesome. Yeah, something maybe a little more, I think, I don't know if up to date's the right way to say it, but yeah, something a little more less punitive. So good information. I appreciate that.
Yep, no problem. And thanks for asking that question, because it is, most of the trainings that are out there are really helpful information. But I think even like I mentioned, they don't even think about things outside of substance use. Most of the reasonable suspicion trainings are just about drug use. And so people jump to conclusions sometimes about why somebody might be acting differently. And we're stigmatizing folks who are potentially not acting themselves in general because of that. So just important to broaden, I think, how we think about addressing all these different things that fall underneath the umbrella of impairment.
Yeah, it's a good point. Yeah, there's so many more issues nowadays than there was maybe 10, 15 years ago. So.
Right. I'm certainly not trying to belittle the need for us to do more on addressing employee substance use. That's one of the biggest topic areas that will probably exist under impairment umbrella. But I think, there's room for opportunity to include other conversations at the table too.
Right.
I did see, Denise, you put something in the chat about the naloxone kits. So I appreciate your comment. I know we were talking about that before the presentation started. So in case it's of interest to this group, we were talking about NSC's new program on addressing and encouraging employers to adopt naloxone now that it's available over the counter. So if you have any stories about implementing naloxone or any thoughts about that, we'd certainly love to hear about it.
Well, I don't. First, my group primarily works with marijuana impairment, but a person that I've encountered out of Rhode Island, it's called Advance Box. They actually have an interesting kit that combines a lot of emergency workplace events. It's a kit that has tourniquets, defibrillator, and the drug overdose products. It's the clinician's name is Jeffrey. It's an Italian name, I don't remember, but it's called Advanced Box. And again,
Advanced box, okay.
yeah, it's an interesting concept to put everything in one place.
Yeah,
And
that's great to hear. And I think more and more organizations are going to be experimenting with what that looks like, because not every work site has a first aid kit for you to pop naloxone into.
it would go right with the first
Mhm.
aid kit, but it would be more
Gotcha.
comprehensive. And I think it's more looking at cardiac and overdose events, because the two might need the same rescue.
Mhm.
Just a little comment. We actually only do impairment with marijuana research. We're federally funded. We've been funded by NIH and NIJ. There's an interesting trend in our data, because we haven't analyzed it. There's a huge difference, even if they might be using the same amount of marijuana, between a true medicinal user, and that's hard to identify, and a recreational user. I think historically, habitually, a true medicinal user, and I mean a real medicinal user that's using it to manage a disease, works hard not to get high. We're finding that their levels of cannabis can be truly high and similar to a chronic user that's trying to get high. In the absence, the medicinal user truly isn't impaired on what we're measuring. So that's going to be a really complicated issue when it comes to the ADA and combining when things are settled down the road. And when it comes to impairment, technologies that measure actual impairment directly related to the job in question are going to be essential.
Right.
We measure impairment of the eye, not eye movement, but actual retinal performance, and that's directly related to many jobs, but we're developing our technology specific for roadside.
Okay.
That's a more complicated, harder issue, because it's a decision based on the technology. Whereas workplace, you've not made your final decision. You've just made a decision to remove the person from the threat, so the technologies don't have to be as precise.
Right. That's
and a good
interesting.
example are the tablets. They recognize many things, you know, in the smartphones. They're never going to be useful roadside because they're not precise.
Yeah, interesting perspective on that. And certainly the topic area of cannabis likes to throw a big wrench into everything. It's very hard to measure and understand impairment, especially related to cannabis. And the research we've seen on both sides that it does impact safety outcomes and it has no impact on safety outcomes. So it's very nascent, I think, is in terms of what we understand about, and what you were referring to, people using the same amounts of cannabis having completely different effects on them individually. And so how can we, as employers, create policies that keep the workplace fair and you know, keep in mind things like the ADA, but also limit impairment. And so for now, our NSC has a zero tolerance for safety sensitive positions on cannabis, which is very complicated. I don't think that's a great solution, but that's just kind of where the landscape is at the moment.
Well, for some jobs, that's necessary. I mean, people assume because I research public safety that I'm anti-marijuana. I'm very much pro-marijuana. On the other hand, again, back to data, certain types of jobs require zero tolerance. Again, we only study vision, and a classic example is when airline pilots were tested with a very low dose of cannabis compared to what's out there, and 48 hours they were still impaired to land the plane. So it depends on the job. And many construction jobs fit the precision of your vision that an airline pilot requires.
Right. Yeah. Yeah, it's a very nuanced topic. And I think a lot of folks in the safety field are trying to figure out the best way to navigate it to keep, you know, employee protections secure, but also to acknowledge that there's some jobs that are much riskier than others. And we just don't have a lot of good data to help us understand where that line is, since there's so much individual variance. So more on that in the years to come. I think it's going to be a continuous conversation.
Yeah, this was very helpful. Thank you for doing this. I mean, everybody struggles and everybody struggles where they fit, and every state is different.
Yeah. Like I said at the beginning of the presentation, this is not a black and white topic area. It's very unclear at times, and I think it's important to acknowledge that we don't have all the answers, but there's ways that you can have the conversations to figure out what's best for your organization to be what we propose is as compassionate as you can, especially because employers have a great opportunity to provide resources to support employees that will ultimately make their workplaces safer too. So it's really a win-win. But it's hard, it's difficult.
Any other questions? See what I tell you, we got some great minds on here. Denise and Darren are adding some great conversation to the topic here today.
Well, a lot of these questions aren't new. I come from the gerontology space. These are all questions that arise with normal aging. And again, so we forget that, cognition, well, right now it's in the forefront with President of the United States. Yeah. So impairment for another reason besides normal aging or disease, they parallel. Again, there are certain jobs that you wouldn't or shouldn't be doing with normal aging. The same jobs.
I definitely agree with you.
Yeah.
Again, well, that's how we got started on our work. We actually were looking at how to better define Alzheimer's and when things are non-functional. That's when we realized the technology we were using that didn't work for early identification of Alzheimer's, just measuring retinal response, works great for roadside impairment, which I'm guessing you don't have us in your category of technology. We are not eye movement at all. We actually measure retinal performance using a virtual goggle. So we measure visual fields of the cells that are harmed or dysfunctional with marijuana. Ironically, 34 states already have laws about driving on what we measure, and all of Canada. So again, just like a job, one impairment may be tolerable for a certain job. On the other hand, that same impairment may be totally inappropriate for another job. And vision is just a starting point. For example, I guess there's a high rate of falls and injury in the restaurant industry with marijuana. That's because it impacts your balance. So again, that particular function may be more relevant to that industry.
That's a great point. And I would be curious to learn more about your technology too. That's something that we're figuring out our next steps on. Outside of the research report we have done, just better sharing information about what's out there and how we can support the research on it. So I'd be curious to learn a little bit more if you have any links.
Many people in the space don't share their information. They want to be the first to sell the product that's going to make $1 billion. We do have to admit, we had thought we'd finish it and get back to Alzheimer's. I don't think I'll do that. Marijuana research is too much fun. Like a party in the lab every day. We only see healthy young adults.
We are funding some research that is using cannabis as a part of, we're using PBT to assess other forms of impairment. And we haven't found a shortage of getting volunteers to participate in that arm of the study for sure.
We are finding you have to screen them heavily.
Yeah.
We pay well, so sometimes their motivation and they're not always honest. So we have a variety of parameters. Like we use this, and I'll share it with you because it's working nicely. This thing called the Cannabis Use Disorder Substance Survey. It's an extensive questionnaire. If that doesn't match our blood results, we consider that person unreliable. And we don't use their data. Because again, money is a motivator for many people.
Sure.
Yep. Good stuff. Good conversation.
You guys don't need to look at me anymore.
Oh no, you look great. Thank you for adding to the conversation. But yeah, I guess there's no more questions here. So just on behalf of the KCA, we just want to thank Claire, and it's an ongoing discussion, and events like this, I think, help the issue and get people thinking about it and get people talking about it. And the resources you supplied are awesome, or not that you supplied, that you mentioned. and I'll make sure to get them out. And again, I highly suggest the training. I think it's great. And if anyone has any follow-up, there you go, Claire. I was going to say if anyone wants to get in touch with Claire, but she just posted her email in the chat. And we will follow up with all attendees, and even those that register that they did not show up today. We will follow up with you as well. So on behalf of the KCA, thank you, Claire, so much. And we value our relationship with the National Safety Council, and keep up the great work. And hopefully the Safety Congress is a success next month. So thank you.
Thanks so much. Thank you guys for the time, and feel free to reach out. And definitely, John, if you can share the link to the Pennsylvania training, I can also share with you the flyer
Awesome.
for the training as well.
Awesome. Sounds good. Well, thank you. Enjoy your day, everyone.
Thank you.
Thank you.
Thank you.